The system of providing medical treatment in the United States is highly complex and bureaucratic. In the United States, a significant number of hospitals and clinics are owned by private nonprofit organizations, which is in contrast to the majority of the rest of the world, where healthcare facilities are typically held either by governments or by enterprises operating in the private sector. Today we will talk about, does the U.S. government offers health insurance? The United States of America is the country that spends the most money on healthcare relative to other nations. In spite of the fact that a significant portion of these costs are paid for by public payers, such as the federal government, state and local governments, and municipalities, private insurance and individual payments can also be used to cover these costs. However, in contrast to the health systems of most other industrialized countries, the one in the United States does not provide medical coverage for the country's whole population. Employers in the United States who voluntarily provide health insurance coverage to their employees and dependents are the primary source of health insurance in the country because the United States does not have a unified national health insurance system. In addition, the government offers a number of programs that are designed to help pay the cost of medical treatment for vulnerable members of society, such as the elderly, the crippled, and the destitute. These programs are distinct from one another, and each one targets a particular category of individuals with its provisions. It is not a simple task to obtain health insurance in the United States. It's possible that some people would believe that once you have money, everything is simple and straightforward, but in reality, it's not quite like that at all. When shopping for insurance, one must exercise extreme caution and keep an eye out for potential red flags. Health insurance in the United States for non-citizens. The government of the United States does not provide health insurance for all of its citizens, and having health insurance is not required in order to legally reside in the United States. Because medical care is so prohibitively expensive in this country, participation is voluntary but strongly advised and obligatory. This is the case regardless of where in the world you live. In the United States, people can choose between commercial and public health insurance plans for themselves and their families. The majority of people make use of both approaches concurrently. Medicare, Medicaid, and the Children's Health Insurance Program make up the public health insurance systems in the United States. Medicare. Medicare is a federally run health insurance program that was established in the year 1966. People under the age of 65 who are diagnosed with end-stage renal disease, amyotrophic lateral sclerosis, or one of several other disabling conditions are also eligible for coverage under this program. There are 4 distinct components that make up the Medicare program. Part A is the portion of the plan that pays for medical care in hospitals, skilled nursing facilities, and hospices. Part B covers outpatient services, including certain physician services while the patient is still an inpatient at the hospital, as well as outpatient hospital charges. Patients are given the option to select health plans that provide at least the same level of service coverage as Parts A and B, frequently the benefits of Part D, and a yearly out-of-pocket spending cap, which is absent from Parts A and B. This alternative is referred to as Managed Medicare and falls under Part C. In order to sign in this portion, you must first sign in Part A and then Part B. Coverage under Part D is limited to medications that patients are responsible for administering themselves. Medicaid. Medicaid is a program that is run jointly by the federal government and the states that assists low-income individuals and families in meeting their medical expenses. Medicaid pays for benefits that are typically not covered by Medicare, such as nursing home care and personal care services. People in the United States with low incomes benefit from this program the most, as it is the greatest source of money for medical and health-related services. According to the available data, the United States was able to provide health insurance to 71 million people with low incomes or disabilities, which represents 23% of the entire population of the United States. Program for the Insurance and Care of Children. This program, which was formerly known as the State Children's Health Insurance Program, provides health insurance for children whose families have incomes that are not quite low enough to qualify for Medicaid. These children come from homes with moderate incomes. Private health insurance in the United States. There are around 1,000 different private health insurance companies operating in the United States. Each of these companies offers a variety of coverage options at a range of costs, the majority of which are determined by the individual's pre-existing conditions. However, in addition to plans that cover only one person at a time, there are also group plans that are geared specifically toward families. Individual insurance can also be purchased. The following are the typical categories of health insurance available in the United States. Traditional health insurance plans that are based on a fee-for-service model, which plans are typically the most expensive, making it harder for people to acquire them if they have incomes that are lower than the average income in the United States. On the other hand, these programs are the best because they give you the most freedom. Health maintenance organizations provide their members with fewer options for healthcare providers, but, in exchange, they cover a greater proportion of the costs associated with preventative care and offer cheaper co-payments. The National Committee for Quality Assurance reviews them and determines whether or not they should be accredited. So, that's it for today's video. What do you think of our video? Hit us up in the comments and let's chat. Don't forget to like, subscribe, and turn on the notifications for our channel so you never miss what's coming next from us. Thanks for watching.